Good afternoon.
Good afternoon.
Good afternoon.
I'm Ray Franny. I'm with the Rotary Club of Mental Health Advocates and working with Rose. Actually, working with Rose on many different things. Rose is a member of the New Jersey Crosstown Mental Health Coalition, so we've been doing a lot of activities as of late. But today, we want to talk about navigating resources. It's so important that people know where to get the help, how to simply get the help, and at the very least, some basic numbers where at least you can make that first call, and then somebody can help guide you through the process. We just had a webinar, if you will, with Johns Hopkins, and we sent out a pre-survey ahead of time, and we wanted to know from people what they saw as their biggest needs for mental health in our communities. And they all weighed in. We got a lot of great data. It wasn't a big sample size. We ended up with about 50 people, but we took all that information, compiled a really beautiful report. One of the top 3 issues was the fact that, how to find the resources you need. How do you connect with someone who can make a difference? So I just got a few slides to show, and I will share these with Rose after the fact, and she can share them with everybody here. And then I'm going to turn it over to these ladies who have generously accepted assisting me today, who are really the experts, right? I do this as a passionate hobby, but they do it as a full-time journey. So emergency hotlines, right? So your primary emergency contacts, at the very least, there's just a couple numbers you really need to remember. And you see there's one colorful sheet we handed out. I'm actually gonna probably make that into like a refrigerator magnet. So you can put that in the refrigerator and it just helps guide you through whatever the situation is, who that first call should be. So obviously everyone's familiar with 911. 911's been around. And I need to find out exactly when that came into existence, but it's been around a long time, right? Someone says 911, they realize that it's a life-threatening emergency, it could be fire, a medical situation, or a crime in progress. Right? And then there's dial 211. And that's one of those hidden gems that most people aren't familiar with, right? It's a confidential link to local community resources for food, housing, and social services. Right? And then we have poison health for poison control, and that number is 800-222-1222, right? So the 911 system, as we said, is medical, and somebody difficulty breathing, they're unconscious, fire, visible smoke, flames, gas leaks, or a robbery or assault is presently occurring, call 911. Then mental health and crisis care, 988, and we were talking about that earlier, but 988 is a number that's been around, I believe it was in July of 2022 when they rolled it out. Ashley said the other day it was 2023, I can't believe it's 4 years now. But they rolled it out, and it's for anybody who was thinking about suicide, could be substance use or any other mental health crisis, right? And support's available in English and in Spanish. So you call 988, and you're going to hear a lot more about 988 because we have the individual responsible for 988 in Union County with us today, right? And then you can text 741-741, text with a crisis counselor. And we also have a number for SAMHSA, which is substance abuse, mental health.
Services Administration.
Services Administration. I knew it would come to me. Thank you, Morgan. And then there's the Trevor Project, and that's for people who are dealing with crisis because of their life choices for the LGBTQ community. Right. And we got safety advocacy. So there's hotlines here for domestic violence, right? Sexual assault, child abuse, and elder abuse. And all these are very real things. And again, I will share the slide presentation with you, but at the very least, if you can take these and do a little preparedness ahead of time. Write it down someplace where you can easily find it, right? And if you need to make that call, the number is readily. Don't wait until the last minute, and all of a sudden a crisis or situation arises, and you said, oh geez, did you call somebody? Don't get me wrong, I love this sheet, it's comprehensive, it's got everything in it, but quite honestly, if I'm looking for a particular tree in a forest, this could be overwhelming, right? So just take a handful of numbers, write them down, put them in a safe place, and have them so you can make that call when you need it.
Or we could just use this and highlight the ones that sort of,
You can do that as well.
Yeah,
That as well.
at least that's,
right. Or put the,
I'm
That's
not saying throw
probably-
that away. I think that's a great,
Put it in your
that's
cell
a great reference to have.
yeah.
Yeah.
this is,
So 211, we mentioned that before, it's managed by United Way. Housing, it's for housing and utility assistance, food and nutrition programs, healthcare and vaccination info, job training, and unemployment help. So 211 is a very good resource to have for so many different things that affect your daily life. And they even have global emergency numbers. Now, if you're gonna do any travel, this is important. 911 is in the Americas, 112 is in Europe, 999 and 112 in the UK, and 000 in Australia. Those are the 911 equivalents. So, questions? Some resources. So that's the end of my little spiel. I am now going to turn it over to Mary Claire from Caring Contacts, and she's going to talk about 988.
Hi, good afternoon. Thank you so much for coming out. My name is Mary Claire Velder. I have allergies right now, so I brought my water with me, so when I start coughing, I apologize. I'm the Executive Director of Caring Contact. Caring Contact is an organization that has been here in Union County for over 50 years. So last year we celebrated our 50th anniversary. We were founded in Scotch Plains as a general listening line. So a place where people could call when they were just struggling. They might be having thoughts of suicide, but for the most part, these were people who just simply needed someone to talk to. That organization expanded over the years, and in, I think, 2002, they moved from Scotch Plains to Westfield. And then in 2005, we became a member agency of what was then the National Suicide Prevention Lifeline. So that is a national network of organizations that when somebody was having thoughts of suicide, they could call a 10-digit number and be connected with someone who would help them stay safe. As Ray said, in 2022, the 988 Suicide and Crisis Lifeline was launched. So we do the same thing, you just reach us through a different number. If you call that old 10-digit number, it still comes through to us. We do the work that we do primarily with volunteers. So for the first 47 years, we did that work entirely with volunteers. People in the community, just regular people, not people who are clinicians, not people who are therapists, not people who are there to diagnose or create treatment plans. People who are there to pick up the phone, hear someone's story, ask about suicide, and help them find a way to stay safe. That might be through coming up with a safety plan where they talk to their spouse or their mother or their religious person or a coach or someone to help them stay safe. It may be them taking themselves to the hospital. It may be them calling out to emergency services and having emergency services come. And in rare instances, it's us having to call out to the police to help that person stay safe. Last year, we answered over 25,000 calls between the 988 number and what we call our warrant line number, we only called out to the police 62 times. 58 of those times, we called out person's permission, meaning we said, I'm really worried about you. I'm concerned for your safety. Is it okay if I reach out to the police and emergency services? And they said yes. The other folks, for whatever reason, could not make that contract for safety with us, so we reached out to the police. That has been kind of, we ended up being somewhere, like 0.05% of our calls each year have to involve emergency services. With the explosion of 988, and when I say that, our call volume to 988 has increased by 90% since it launched. So when I joined the organization in 2017, we answered a little over 1,500 calls to what was then the National Suicide Prevention Lifeline. This past year, we answered over 15,000. We're on track to answer closer to 20,000 calls this year. The organization that is the overseer of 988 has a contract with the federal government, that organization called SAMHSA. And so once the federal government got involved, as you can all imagine, there are now lots of regulations and procedures and metrics and things that we as an organization need to meet in order to continue to do the work of 988. So with that, the only way we were going to be able to go from answering 1,500 calls to answering over 15,000 calls was to start to involve people who are getting paid to do the work. What we've done to date is people who've gone through our training program. So they're doing the work the way that our agency wants to do it. Those are the people who are now employed, and they're all part-time. And I say that because, as you can imagine, this is heavy work. This is difficult work. And we would prefer as an agency to not have people doing it 40 hours a week. Having someone do it 5 hours a week or maybe 15 hours a week keeps them in a space that is safe for them to do the work and to better serve the individuals calling us. So the people answering the phones are people like me. I'm a trained crisis line counselor. I have a master's in public policy. I do not have a psychology degree or a clinical behavioral type of degree at all. I learned to do the work by doing our training. And we have a little over 100 people doing the work with us right now. So the people answering the phones are very much like the people calling us, meaning they're people from all different types of backgrounds. There are stay-at-home parents, there are bankers, there are teachers, there are lawyers, there are retirees, all these different, from all over this northern part of New Jersey. We answer calls for 7 counties. Let me see if I can get them. Middlesex, Somerset, Union, Passaic, Essex, Morris, and Union. And the folks who answer the phones come from all of those counties as well as other counties here in the state of New Jersey. We've had people as young as 6 call us, to people who are well into their 90s. We don't have a lot of really, really young children who call us, but we do have a lot of tweens, a lot of high schoolers, a lot of college-age students. But we also have a large number of individuals who are seniors calling us. There is truly an epidemic of loneliness in this country, and 988, while it is a suicide hotline, is also a place where you can call if you are just having a hard time, if you're in some sort of emotional crisis. You don't have to be having thoughts of suicide to call us. We also have a lot of parents and people who call us who are worried about somebody else in their life. So parents who are worried about their child, a spouse who's worried about the person they're married to, people who have parents that are older, calling, wondering what to do, the words to use, how do they help keep that person safe? So about 1/3 of our calls, we call them third-party callers, our third-party callers. 988 is also there to assist people who are struggling with substance abuse disorders. So part of what we do is help them stabilize, help them de-escalate, and then connect them to services in the community so they can get help as well. Let me think. I'm going to pause for a moment. Does anybody have any questions? That was a lot to take in. Yeah.
Yeah, just, you did mention that the folks that work for you don't have the formal education, but they do still have the training.
Sure.
Like yourself, you trained yourself on the job.
Correct.
Out of the blues, if I wanted to, I'm an ex-banker,
Yeah.
wanted to work the hotline for,
Sure.
say, five hours a week or something of that sort, what are the requirements that I would have?
Sure. So we offer a 54-hour training, which is based in active listening, the ability to sit, to listen to someone's story, to reflect the feelings that they are having, make a connection with them, and come up with a path to their safety. And the path to their safety is based in the suicide intervention training that we provide, the certification that you would receive during that training process. We use something called ASSIST, which is Applied Suicide Intervention Skills Training. It's an internationally evidence-based program used to keep people safe who are having thoughts of suicide. So you would have that training piece as well. We then don't have you just finish the training and have you start picking up phone calls. You have about 24 hours of supervised listening that you do before you start to take those calls. We ask that you give 9 hours a month to the work that we do. So it's 3-hour shifts over a period of a month.
Yeah, the 54 hours you could sort of stay at home and
So
train yourself?
Yeah, so, COVID, I'm a glass half full girl. So I try and look at those sorts of things that happen and say, okay, well, two of the things that came out of COVID for us was we used to have a training that was entirely in person, which meant that if you lived in Huntington County, it was really hard for you to drive once a week and then drive 3 times a month to do the work with us. So during COVID, we had to do something, right? We had to quickly shift in order to keep training individuals because we didn't know, in March of 2020, nobody knew how long this was going to last, what this was going to look like. So we created initially an entirely online training program. And then once we were all allowed to gather together again, we went to a hybrid schedule. So now we have 5 classes that are remote and 5 classes that are in person. We hold them here in Westfield and in Scotch Plains. And then we have one weekend where you come and you do that ASSIST training. Do people know where Imagine is?
Yes.
People have heard of Imagine. It's here in Mountainside. They have a beautiful facility, and we usually do our ASSIST training in that facility.
Thank you.
You're welcome. You're welcome. Anything else?
But
Yeah.
I probably know, sorry, but when they do answer phone calls, it has to be at the facility, right?
Initially.
Oh,
So,
okay.
thank you. The second thing that came out of COVID was that before, all of the work had to be done in our call center, which is in Westfield. Again, in March of 2020, no one knew how long that was going to last. We were deemed necessary, the word's escaping me, but that we could continue the work that we were doing. But it meant we could only have 2 people in at any time doing the work because we only had 2 call rooms. So what we did pretty quickly is we changed our phone system over to a voice over IP system, and then people could start to do that work remotely. Now, of our 100-ish listeners, 43 of them do the work remotely. Initially, we have you come to the office and do that, just because people feel more comfortable, as you can imagine, taking calls that might, in those initial days, be somewhat overwhelming. But now they can do those work. They can do that work remotely.
So the remote people that do work, are there any guidelines? Because is any issues with privacy?
Sure.
Yeah.
Sure. So we don't fall under HIPAA guidelines, but with the federal oversight, of course, there's all sorts of privacy regulations that we have to follow. So I have an IT person now. 5 years ago, I had a third-party person who did all my IT work. Now I have a full-time person because I have all these remote listeners. We have all the cybersecurity pieces that have to go on, and nobody wants me taking that on. And so, yes, we have all sorts of rules about where you take those calls, how calls, we do record calls. We record them because we want to do the work better. So we use them for training purposes. And then I think after 3 months, everything is destroyed. But it's safely kept on a server in our office. Yeah. And the calls to us are, they're not anonymous. They're confidential. Meaning, if somebody calls, I have caller ID on my phone and I can see who's calling me. And we do that in the instance where somebody cannot contract for safety. If somebody can't tell us that they're going to be safe, we may need to send somebody out. We are 100% upfront about that. People are free to just hang up the phone and say, I don't want to do this, we're not going to call them back. We do offer follow-up to individuals who are having thoughts of suicide. They are free to say no. If somebody wants us to call them back, we call them back. And I'll end with 988 has 3 pieces: someone to call, someone to come, and somewhere to go. In the state of New Jersey, in 2022, this first part was launched, which is someone to call. Last year, we launched what is called MCORT, which are the Mobile Crisis Outreach Teams. These are teams of individuals throughout the state. When somebody calls 988, we do our work, right? We make sure that they're safe. We make sure that they are not at imminent risk of harming themselves or harming anyone else. And if it is appropriate, we will offer to them that one of these mobile crisis teams could come out to them. It's been up for about a year now. It's been a really beautiful extension of the work that we do. There are some individuals who we've de-escalated and we know they're safe, but having somebody else come out and sit with them to help them further de-escalate. And the beauty of this is to connect them with resources in their community. We have a resource module set up in our office so we can use some with 211. We have our own that we've created, but the folks that go out with the mobile crisis teams, they know exactly who in their county are the correct resources and can oftentimes take the person there, make the phone call with them, and help make sure that they are connected to the service that they need. The final part is the the crisis stabilization centers. So this is somewhere to go. The first one was opened in Newark on the Rutgers Newark campus. It's actually run by Rutgers Behavioral Health. It is a place to go in lieu of going to the emergency room. Going to the emergency room if you're having a mental health crisis is just a really traumatic, difficult situation for someone. And I don't mean that to throw shade on emergency rooms. It's just not what they were set up to do. So to have a place where you can go, it doesn't have that sterile emergency room feel. You're not put into a room and then just left to sit there where they try and go find a psychiatrist to come and evaluate you. You can go there. You can go there with your family. It's a conversation. It might be med management. It might be setting you up with a therapist to go and see. It could be a whole array of things, but it is a place to go rather than going to the emergency room, possibly sitting there for 4 or 5 hours until they can figure out where to go and what to do with you. So I really applaud the state of New Jersey. We are a state that has a bazillion services, which is awesome, but also a problem because people don't know what's out there, where to go, what works, what's good. But we really do try. Does anybody want to take a guess at which state in the country has the highest rate of suicide?
California. Alaska?
Washington.
Alaska is correct. Alaska, Wyoming, Idaho, Louisiana, Alabama, places where there are lots of rural populations and lots of places where there aren't great services provided to their residents. And I don't mean this to be political at all, but also out west, a place where there are a lot of guns. More women attempt suicide, more men die by suicide. And that's because men are more likely to use a firearm and women are more likely to attempt with pills or cutting. And so they get discovered and they can be taken and helped. So New Jersey has the lowest rate of suicide in the country. It's usually us or New York. It is because we really focus on, well, there's two things. One is we have a lot of services. People would think being packed in and everybody really kind of being in each other's face would make for tension, but what it does is it creates a protective factor for people who are having thoughts of suicide. Someone's watching you. Someone, it might be saying, what's going on? And those are ways of protecting each other. During COVID, suicide rates dropped. They've since ticked back up, but people came home. People had their eyes on each other. And what I will ask you is, we do this work. We are more than happy to come out into the community and to teach you, to teach your communities, be it your house of worship, your school community, Boy Scouts, whoever it is, your book club, about what we can do as regular people. We do this work with regular people to look for the signs of somebody who's struggling, then what to say and what to do. And the what to do part is actually really simple. The what to do part is to call 988 and let us help that person. So I just ask you to be brave, and if you're worried about someone, please ask them. Please ask them if they're okay. What I will say, and I'll get to what I will say is when you are on the lines and you ask someone, and I'm not making this up, you ask them about suicide, you usually get one of two responses. One is, no, I'm just really having a crappy day. Or two, an audible sigh, because we're probably the first person who's asked them. And they'll say, yeah, you know what, ma'am? I am. And then we just start a conversation with them. I know that sounds so simplistic, but it works. And so I invite you, if you're interested in
Yeah.
I will be more than happy to tell you more.
Sure, I'll get in touch with you. The question that I had was, what percentage to that point of people calling to 988 are non-suicidal?
Yeah, that's a great question. So I would say that probably 80% of the people who call us are just in emotional distress. And when I say that, you will pick up the phone and somebody will be sobbing. Like you'll think like, oh my gosh, this is the call. This is going to be the one that is really, really difficult. And if you give people a moment and you start to ask them some questions, they really de-escalate. So 80% is that. I would say the other 15%, one other point is that Thousands and thousands and thousands of people walk around every day having thoughts of suicide. They will probably never act on it, but they're having these thoughts. And so the other 15% are people who are calling us and they are having thoughts, but they don't have a plan. They're not driving to a bridge. They're just having these thoughts and they need somebody to help them de-escalate in that moment and help them figure out, well, what do they do next? Is it a connection with a therapist? Is it telling their spouse, like what is it? And then the other 5% are people who are, are driving to a bridge.
Well, I expected the number to be high, very high, but not as high as 80%. Because it's not everybody who's picking up the phone, it's like, I want to kill myself.
Right.
No, there's a
Yeah, so
reason.
80%
My neighbor cut the tree down and it fell on my garage.
Right, or, a lot of kids, my boyfriend broke up with me, I didn't get into
Yeah.
college, I didn't, things that seem, for them in that moment, life-altering, right?
Yes.
And it's never for us to say, don't worry about it, you'll get into college.
Nothing is trivial.
Never, ever, right? I don't know, right? I don't know if she'll ever get into college. Maybe she won't, but what I do know in that moment is I can listen for how she is feeling, and I can let her know that her feelings are legitimate.
Comfort.
Yeah. So, anyone else? All right, well, I'm more than happy to take any questions afterwards. We're here, we're your neighbors right next door in Westfield, and if anyone is interested in volunteering, I'd be more than happy to chat with about that with you. Also, if you want my trainer to come out, she's incredible, and we gladly arrange that. So, thank you very much.
We have never mindful to be flexible and to go with the flow. We have to leave this room because they have
Oh my gosh, I'm so sorry.
chair yoga coming in. Is it chair yoga? I think it's chair yoga is coming in here. But there's a room right next door where we're gonna have Morgan speak to Rick and then complete this meeting.
Just give a little gap.
Should I go ahead?
So,
Yeah, sorry about that.
No worries, no worries. Well, thanks so much for pivoting with us from one room to the next. And Mary Claire, thank you. That was, as always, a wonderful presentation. I was supposed to go first, but I asked Mary Claire to go first for two reasons. One, she's a very inspirational speaker, and I always get a lot out of what she has to say, and it helps me think about my own work in a different way. And number two, does she not have the most calming voice, demeanor, and so I get my jitters calmed down a little bit. And then this is also much better acoustics. I don't have to, raise my voice, which is always helpful too. So thank you all. Really glad to be here with you. Thank you, Ray, for the invitation. My name is Morgan Thompson, and I'm with Prevention Links, which is a nonprofit based here in Union County, and our focus is really around preventing the devastation of addiction and problematic substance use. So very much in line with the work that Mary Claire and her team does. So, and we just celebrated actually our 55th year, and we do a number of things here in Union County. We've also grown to service Hudson and Middlesex counties as well. So the ways that we help. First, we educate the community through coalition building. And so we've been operating a drug-free community coalition here in Union County since 1996. And there are coalitions like it all around the state and all around the country. And what's really unique about them is that they bring together all segments of the community, educators, and the superintendent had to go, but it was great to see him here. He's a tremendous supporter of our work. Educators, the medical community, law enforcement, emergency medical services, and concerned citizens who want to make a difference. And by having all that varied expertise and all those varied resources coming together around the issue of substance use, we're able to mobilize in the community to educate parents and caregivers and youth and all different groups about what's happening. I'm sure many of you are aware that there's been an ongoing opioid crisis all across the nation, but especially here in New Jersey. It is getting better. We're seeing fewer and fewer overdose deaths here in Union County and throughout New Jersey. And a big reason for that is that we've gotten really good at getting Narcan in the hands of the right people. And the right people is everyone. Everyone should carry naloxone or Narcan, which is the overdose reversal drug. And that is available in pharmacies. You can go to most pharmacies in the state participate, and through a program that the state operates, you can just go to the pharmacy counter, ask for Narcan. They won't ask for insurance, they won't ask for payment, they won't ask for ID. They'll give it to you because they want to make sure that every single person who has the opportunity to save a life with naloxone has the opportunity to do so. So there's one resource that you can all keep in your back pocket, is the Naloxone 365 program. So those are the types of efforts that we as a coalition help to advance all throughout the community. We also work in the schools. We know that we can stop addiction before it starts. There are programs, Eric there talked about evidence-based programs. So there are evidence-based prevention programs, and they all look a little bit different because they're geared towards different age groups. Prevention works when it happens continuously, one year after the next. We can't just do one big assembly about drugs are bad and expect young people to take us seriously and to make informed choices about their health. So what we do is each year we start with different social emotional skills, relationship building, communication skills, coping skills, and we help to teach and to practice those skills with youth throughout the grades and helping educators to understand how to reinforce those skills in real time. And so, that's really one of the biggest pieces of our work. We work in almost every school district here in Union County and even outside of the county. And we've been doing that since the early 1990s. We also know that we can't just work with young people, we need to work with their families as well. We need to teach parents what the drug environment looks like, what to look for, what the risks are. But even going further back, we need to help parents to feel confident. I'm a parent of a 6-year-old. I'm still learning every single day, and I'm sure anyone who's been a parent knows that that never ends. But it's a different environment. Social media, just all the different pressures that young people face. We want to make sure parents are equipped with the skills to be able to show up for their children and really help to protect them. We know that young people who have strong relationships with their parents, who feel like they can talk to them about these things, are less likely to develop addictions later in life. So that communication and that openness is really important. That's part of the work that we do with parents. And then we also work with individuals who are affected by addiction. We help navigate them to treatment. We operate, actually, on the very dense resource guide, we have a special box that stands out a little. I think it might be like a half a font size bigger than the rest, but it says the Union County Helping Hands 365 hotline. And so this is a line that's, or I shouldn't say helpline, but it's staffed by peer recovery specialists. So people with lived experience of addiction and recovery, people who have been there, have walked that path, and have had others help them through that journey. I myself am a person of long-term recovery. I started in this work as a peer recovery specialist working with young people. And so there's just something different about having someone who can be that source of hope, who can talk about, this is what it was like for me. It might be different for you, but here's what I experienced. And to help someone find what resources are going to work for them. For a long time, the way the addiction treatment system worked was that if people were lucky, they got into treatment, and then they were told, go to an AA meeting, and AA is great for a certain set of people, right? Many people are helped by 12-step programs. Many people don't feel comfortable in 12-step programs, and so we had to make other options available. It took a little bit of a long time to do that. We also have started to see that there are more and more medications that are very effective in helping people to recover from substance use conditions. And while there aren't medications for every specific type of addiction, we do have them for alcohol, for opioids, and there's a lot more that are being tested now that hopefully will be available soon. And so that combination of treatment, medicine, And then social support was another really missing ingredient from our addiction treatment system until recently. And so now, across all 21 counties of New Jersey, we have recovery community centers. Prevention Links operates 3. Here in Union County, we have locations in Roselle and Plainfield, and it's called Rise Up Recovery Center, my brochures, so I'll make sure everybody gets a copy of that. So what goes on at a recovery community center? It's a lot like belonging to like a gym, right? You get a membership, you're a member now. You can just come once a week for a group, if that's what you want to do, or you can come every single day and meet with a peer recovery specialist, work on your resume, work on, figuring out a plan for stable housing. So all the different areas that a person might be affected in trying to build a stable life in recovery in the community, we help to address through the recovery community centers. It's a comfortable environment where people can really feel empowered and connected to other people. There's a common slogan out there, the opposite of addiction is connection. And so that's what we really strive to create at our recovery community centers. So that's kind of the big overview of what we do. I think the most important takeaways for just everybody is naloxone, have it on your person, get trained.
Could you spell that out, please?
Naloxone. And in the bags, I'm hoping.
I might have them too from, well, we have, I might have a couple left over.
There's a lot.
Do we, John? Okay, I'll make sure we bring them.
Did I come and do a presentation?
Yes, you did our presentation, yes.
Yes, and you gave
Morgan,
us
just kind of an FYI, that's one of the things that our club is doing. Is we do an opioid education and a naloxone program for a lot of Rotary Club. I've been like about 48 of them now. And then we distribute kits to everybody there because we're very fortunate that New Jersey Harm Reduction Coalition sends us the kits for no charge. So,
Yes, it's fantastic.
so we're trying to.
I didn't even know that this exists. It's
awesome.
really important to just carry it with you if somebody, you never know. It's like,
Yeah, they say everybody should have it in their car. Like, everybody,
Well, yes and no. 2 months a year you can probably keep in your
Well,
car.
there's that,
You got
yes.
30, I just did a presentation yesterday. 36 degrees is the low end, 77 degrees is the high end. So you've got that.
So you
Yeah,
can't
that
really
40
do that now. 'cause-
No, because even on a day like today, if the car's closed up, this and that, your car's gonna heat up above. Yeah.
The water
so-
bottle's not safe, your weekend's not safe.
I have to carry a man baggie or whatever.
Very nice. Love
Well,
the
it's got 100,000 things in there.
Yes.
And it's what,
100,001?
It's not that big, we could
Yeah,
probably,
so just
No, they're not
what's in
that
there?
big, they're small.
if I remember
but
correctly.
will save a life.
Right.
Yes.
Yeah, yeah.
Some people carry
one
it.
nozzle, not 2. One.
Oh, is it that big?
I'm serious.
That's a nasal spray.
Nasal spray.
Nasal spray.
Yeah, only on one side.
Okay.
Either side, but only one.
Another one. I
That's
tried
right,
not-
what, just one
Yeah, don't use
side?
both sides.
Yeah, okay.
Yeah.
So that's number one, naloxone. Number two is this helpline number. So if
Yeah.
you'd like to connect and like 988, which is more for crisis, this is really, also for if you just want to talk to someone or if someone you love is experiencing addiction and you don't know where to turn.
Yeah.
This is a really great resource to just sort of talk through. If they're not ready for help, what help is available to the family and how do we help to guide the person who's struggling towards help seeking. So I'm going to give everyone a bag that'll have our services, our locations. There's also some information about our Recovery High School, which we're very proud of. We opened the first Recovery High School in the state. And that is for students who have a history of substance use challenges. They go to treatment, they get stable, and then they go right back to the same friends and the same stressors. And so being at a Recovery High School gives them not just the support of professionals, but of peers who are on the same journey they are. We also operate.
So your recovery high school, pardon me to interfere,
That's okay.
is all the students, all of them 100% are recovering?
Yes.
So,
Yes.
that's interesting.
There's 2 other schools in the state, by the way. There's one in Monmouth County and one in Cape May County, and there's about 40 others across the country.
And Morgan, where's your high school located?
So we're in Roselle. Our Recovery Community Center is on the ground floor, and then the Recovery High School is on the top floor. So we're
That's
in
great.
the same space, right over by the Walgreens.
Okay.
New Jersey statewide student support services, I spoke about our prevention programs. There is a statewide program called NJ4S that has really greatly expanded the availability of not just prevention, but brief intervention services in the schools. So here in Union County, we have prevention specialists who deliver these programs at the school's request. And we also have a system where schools who have a student who, maybe is experiencing grief or going through that breakup or just having some sort of something that doesn't rise to the level of crisis, but that they just need a couple of sessions of support. And we can deploy our clinicians to meet with them for several sessions. And if there's a need for additional support, we help get them to that support. Or, in most cases, just that little bit of help within the school day is really making the difference for these young people. So it's another great program, and we hope that it continues to be available across the state. So
Okay, good.
yes.
In Union County, how many districts are using NJ4S?
Okay, that's a great. How many districts?
Well, yeah, school district, because I know talking to somebody in Morris County, they're a little less than pleased by the number of schools that are actually participating.
Yeah. Okay. Hold on now. I'm gonna get my.
I'm sorry. I'm sorry. to do
sorry.
this to you.
Oh,
No,
no way.
I want to give you a precise number because I happen to have a precise number. I'm not as good at the numbers as Mary Claire. She's got them all right off the top of her
Don't ask to
head.
get anything that detailed.
I missed my chance.
All
Still in the room, Red.
because this isn't on my mind at all. Okay. So in Union County, so of high need school districts, there are 9 high need school districts in Union County. All 9 of them are engaged.
Okay.
The moderate need school districts, there are 7 eligible, and we're in all 7.
Okay.
And then the low need school districts, there are 9, and we are in 8.
Oh, that's good. That's
Yeah.
great. That's wonderful.
So we're very, we've been doing this a long time with Union County Schools. It's not this particular program, which is a massive expansion of what we're able to do, but
Yeah.
we've had relationships with school districts, as I said, since the
And that,
90s.
yeah,
so.
I mean, I think it's a great program. I don't know why any resistance, but some school districts apparently have, for whatever reason.
Yeah. I'm not sure.
Yeah, great, thank you.
Okay. Any other questions?